Welcome to another episode of Abimbola Talks. We really appreciate you. I hope you have watched the previous episode so that you'll be able to continue with us. So today, last week we talked about pregnancy, conception as it relates to our mental health. So this week we are talking about, let's talk a little bit about infertility and also fetal loss. You know, we always talk about the good things. What if something happens? What if after marriage you are not able to get pregnant? Just as I said in my previous episodes that take your time. If you wait for 1 year without, birth control and see a fertility doctor, or if you have an underlying condition, in 6 months with no pregnancy, see a fertility doctor. And it's not just the woman that is involved. So the reason why I'm talking about this infertility is because, many people, they always believe that it's only the woman that is concerned when it comes to not being pregnant on time. But I want to let you know that it's not just the woman 100%. Sometimes the man is also might be the reason why this is happening. I'm saying this because we go for prayer meetings when you say, asking for the fruit of the womb is women that are there. When the in-laws are saying, it is the wife that is not pregnant. I just want to clear this so that we know that when it comes to this, the women are usually burdened with so many things. And I want also the people to know that whatever she's going through, she knows she's going through something. You don't have to remind her that, have you seen the doctor? It depends on the closeness that you are to that person for you to start dishing her some advices. If you are close to her to some extent, you can ask her, how far are you going? And also, you, the person, don't sit down and say, I'm praying about it. Go see a doctor. The technology has come to an extent that there are so many alternatives out there. If you don't go, how will you know? The men, if you don't do so many tests, how will you know who is responsible? How will you know? Maybe it's just a little thing that you have to do in order to cross this hurdle. So now we continue. That is just about little advice about infertility. I know you are going through a lot right now. Your mental health is all around, it's everywhere. Stay calm, listen to doctors' advices, take your medications, attend all your doctor's appointments, and make sure you go with your husband. Don't let the husband say, no, don't, just wait, I will go. No, both of you are in this together so that you can have a good outcome. So now, the topic that nobody wants to talk about, loss. What if you get pregnant and lose the pregnancy? Which happens most of the time. There are different reasons for fetal losses. There are different reasons for spontaneous abortions. There are different reasons for stillbirth. It might be, it's the reason why it's commoner among immigrants is just for access to medical care. It has been noted that lots of immigrants are not accessing healthcare as it's supposed to be. Maybe they come to a foreign country and they say, I don't have an insurance, and they don't ask questions. That still rolls down to the fact that you have to ask questions. You have to belong to people that looks like you for you to be able to ask questions. So access to medical care and also culture of saying, I don't want to see anything. You get pregnant. A typical Africa, when you get, even when their pregnancy is so big, when they are going to the hospital to have the baby, they will say, I'm just going to the store. They will not say they are already pregnant and that they are going to the hospital. So what I'm saying is that leave that African mentality behind. Leave that my home-based mentality. When you are abroad, we are all who we have. We are all, supporting ourselves. So when you are pregnant, make sure that you ask questions. I'm pregnant. Which hospital do I go? What do I do? I don't have an insurance. What do you think I can do? Ask questions. And mind you, do not sit at home. Then you say, okay, you are pregnant, and you are not accessing all the medical care. That, oh, you are sitting at home, I don't know where to go, and the husband's like, don't tell anybody that you are pregnant. No, don't do that. Make sure you ask questions. Where do you go for your prenatal care? And peradventure, you lose the pregnancy. Pregnancy loss, it doesn't matter how many weeks, it takes a toll on your mental health. Guess what? Many people, probably immediately you get pregnant, you already started buying things. Oh, maybe I'm going to have a boy or I'm going to have a girl. You already buying stuff. You already started planning. Your emotions is everywhere. And all of a sudden, you start bleeding. Or all of a sudden, it depends on how many weeks pregnant you are. You are not feeling baby movement anymore. And you go to the doctor's visit. They'll be like, oh, what happened? I don't know. I just can't feel my baby move. And guess what? They said, oh, you lost the baby. At that time, for somebody like me that have experienced this before, your life just revolved, like, what am I? At that time, you hit a blank spot. That what am I doing? You start praying. The prayer might be too late. You start thinking, what will people say? They saw me pregnant. My dear, don't think about what people are going to say at this time. Think about yourself, your mental health. I've seen so many people hard that they told them that they might have lost the baby and they go home. They don't want to come to the hospital because definitely they're going to induce the baby and you might end up, seeing the dead baby. But hey, it does happen. But this can lead to mental stress. Then there will be inability to sleep. And if you lose your sleep, that's when you lose your mind. You are not able to sleep. You don't want to talk to anybody. You are just brooding around. You don't want to eat. You don't want to talk. You'll be falling more into depression. When there is life, there is hope. So definitely, if that happens, make sure you go back to the doctor. What can we do? The earlier, the better. You don't want to sit at home and be spiritualizing it, that I'll continue to pray. The more you stay, the more there's tendency of having infections. So you don't want infection to set in and also cause another problem. And this thing I'm going to say, sympathizers, it is okay for you to be around for the person that lost a baby. But please do not advise when it's not needed. Hold her hand. Hold his hand. Pray with them. Don't bring your suggestions at this time. Don't say, it happened to me before. You'll be pregnant again. No, that is not a good statement to say. Don't say you will be fine. What if she's not fine? The best statement to say is that, what can we do? How can we help? Let her voice out what kind of support that she has. Don't say, it is just 12 weeks. Even if a pregnancy is a day old, as soon as you know that you are pregnant, you start planning. So whatever it is that happens to that pregnancy, it is a total blow to your mental health. So this is what we are going to talk about today. If you need help, seek for help. Can you imagine you were planning for a baby shower and now you are planning for a funeral for a baby that you never had the opportunity of holding alive? Or sometimes there are some people that give birth to those babies. They are alive, but they will say, you know what, it's not going to be alive for that too long. This boils to the fact that make sure you ask questions. Ask the doctor, what can I do? What happened? If you have to do an autopsy, go ahead. If they give you that option, do an autopsy. Because you want to know, just in case for another time. If you are a first-time mom and they say you lost this baby, you want to know what happened. Is it genetic? Is it RH incompatibility? Did it just happen like that? Because sometimes it is just idiopathic. They will say they don't know what happened. So seek for options. Whatever option, are they going to do? Are they going to do some biopsy, pathology? Tell them that yes, I want it done because I want to know what happened. Don't just say, oh, I don't want anything. Just don't spiritualize it. Make sure you want to know, and also talk to your doctor. I'm not able to sleep. I just feel down, which is normal, But when it goes to an extreme, that is not normal. That means you are falling into depression. And the more you fall into depression, if you have any underlying mental health issue, you're gonna, who knows, you might have bipolar that is not treated, and that might make you go psychotic, and we don't want that to happen. So ask questions. Infertility, seek for help. Seek for doctor's help. And it is not just the husband alone, both the male and the female. And in-laws, please, friends, keep your advice to yourself. They know that they are not able to get pregnant at this time. You might not even know. Maybe they are just still waiting, that we are not ready. You womb watchers. Immediately somebody get pregnant, married, you are looking at her belly. When is she going to get pregnant? You know what? Mind your business. Let them take care of themselves. Let them enjoy themselves. You don't have to use a flashlight. Be looking for someone that is pregnant around. And when you get pregnant, make sure you have a trusted person. Tell the person that I'm pregnant. What can I do? Where do I go? Which one is more accessible? Do you have insurance? And and also in conception. Okay, now you're pregnant. Unfortunately, you have a fetal loss. Well, it does happen. But the thing is that don't stay on it. Make sure that even when it happens, ask questions. If they have to do an autopsy, if the baby is big enough to do an autopsy, tell them that you want to know what happened, and make sure you take care of your mental health. Tell the doctor, I'm not able to sleep, I can't eat, I think I'm falling into depression. Let them know what is going on so that they can help you. Thank you so much for listening to this week Abimbola Talks. We are going to talk about something else next week. If you have any question about the topics that we have discussed, please, let me know. Call me. My phone is not private, it's public, it's on Facebook. Thank you again for watching our broadcast this weekend. And you can reach out to us on Facebook, Abimbola Talks on Facebook, Abimbola Talks on YouTube, and at Sissy Bimbo on Instagram. Thank you. I'm here to ask you questions. If I don't have an answer, definitely I have experts as friend to help me answer your questions. And if there's anything you want us to talk about, please DM me. We'll definitely talk about it. Thank you so much. Have a wonderful weekend. Bye. Love you.